I think there's many reasons why a fellow would want to train here at the University of Cincinnati. As the program director for the Abdominal Transplant Surgery Fellowship, I really want the fellows to run the show. So a fellow comes in, a fellow starts their training, they're going to hit the ground, they're going to figure out what they need to do, how do they manage the patients, the subtle differences to general surgery patients, and then really they can have the keys to the castle.
I think we have a great training program here in Cincinnati that has blossomed over the years, and it's built on 3 pillars. 1, we have high volume. 2, we see a lot of acuity and we think outside the box on a lot of things. And the third thing is I'm really proud of our faculty and our overall program that we have, because you're going to be learning from people that are on the edge, they're thinking about things, they're leaders in the field, and that's what we want out of a training program.
For me, a transplant surgery fellow is somebody who's already a fully trained surgeon. The goal is essentially to make them into a specialist that is eventually able to replace us and become a new beacon of hope for many people that are coming through. My goal and my primary focus is to make them be able to know how I think, and that will allow them to figure out how they want to think in relationship to integrating all the data they get from different attendings.
I feel like my case, the cases that I'm involved in, have gone the best if I didn't throw a stitch. If we can do cases where we see the experience that the trainee is getting out of it, whether it's a resident or a fellow for that matter, that tells us that we're doing our job. And I think that's our philosophy and our mentality, and that's what I try as the leader of the group to convey the most.
We spend a lot of time together, the faculty, the fellows, because quite frankly, it's, you're up at night and you're doing a lot of times off hours working together, and so it's really important that everyone gets along. We think we have a really close-knit group of surgical faculty here. If a fellow has an issue, many times I've seen fellows come to myself, come to other people, and just ask for advice. So I think developing a close relationship amongst the faculty members and the fellows is one of the key things about our program as well.
I actually hate everybody. I think there's no better place here than here at the University of Cincinnati. Everyone gets along, everyone makes fun of each other, and I think that's the good part of being here. There's probably no other place that you could go to that you're going to find a place where you just have a good group of individuals who want to have fun. We all have one purpose, and we're all here to do the best we can for our patients.
I think that fellows should want to come here for the same reason that I wanted to come here as an attending, that we have a young, energetic group of attendings who really focus on education of fellows and residents as a priority and are determined to both advance the field of transplantation and train new surgeons to join our field.
The opportunities for a fellow to become that provider that they want to be is extraordinary. They will get the kind of independence they need even from day one, because we anticipate that you are a fully trained surgeon and you are treated as such. Our goal is just to modify your procedures and your thought process to become a transplant surgeon, but you have the ability to monitor your own cases, direct the course of your own education. I think your voice is heard and your input is very valued. So if you want a place that has the ability to make you feel and really grow into the attending that you want to be, this is a great place to be.